So I'm going to talk to you about the breast implant recall from Allergan. Allergan is one of the major manufacturers of breast implants, and there's an issue regarding a certain type of very rare cancer. So there's two types of breast implants that we're going to talk about. There's different natures, but in general, there's a smooth one that is like this here. It's pretty clear. You can see through it, and the surface is smooth. And this one here is called textured, so it's a little bit, maybe a little bit rougher. And the purpose of the textured implants is they have a little bit less incidence of what's called capsule contracture. So they tend to stay softer longer. Most of the implants in the world are smooth, particularly in the United States, but some are textured, and textured were designed to overcome a problem. But what happened is that we discovered very recently that these textured implants had a very low incidence of leading to a type of cancer, and its cancer is called breast implant associated anaplastic large cell lymphoma. It's a cancer that occurs from the capsule itself. The capsule of the breast is a lining that forms inside the breast tissue that surrounds the implant, sort of like to wall it off from your body. And the texture was designed to slow down that activity. And what happened is that some of the cells in that capsule would mutate and turn into a rare form of a lymphoma. And at first there was some inklings that there might be a type of a lymphoma associated with breast implants, but it was extremely rare. There's about 700 cases worldwide reported. And then it turns out it was mostly related to, not mostly, it was all related to textured implants. So Allergan's decided to recall them voluntarily. Now the recall, I'm going to get into it a little bit what that means and talk to you about how do you know if you have this type of rare, very rare cancer or not, and also what your steps might be. So the recall for the implants takes effective last month in July through July 2021. If you want to have your implants exchanged, Allergan will pay for a new implant, taking a textured one and changing it into a smooth one. They are not covering the surgical fees. That might change in the future, but they're not doing that. Now, how can you know if you have potential to have breast cancer? A lot of women are very worried, and they may be not ready to get them taken out right now because there might be some time they're going to figure out how they're going to go about doing that. The current consensus guidelines, this right here paper, it's written in an editorial decision date December 13th, 2018. It's called the 2019 National Comprehensive Cancer Network Consensus Guidelines on the Diagnosis and Treatment of Breast Implant Associated Anaplastic Large Cell Lymphoma. Okay, so this is the guidelines that surgeons are probably going to follow in general. The first part about the guideline is we're going to do a physical examination or report to your doctor if you have any symptoms. And the symptoms are defined as swelling, mass or like a nodule, skin rash, skin ulcer or skin breakdown, greater than 1 year after an implant. And the average diagnosis time is about 8 to 10 years. If such things exist, we do an ultrasound or MRI. The ultrasound can detect if there's fluid present. There's normally might be a little layer of fluid, but the guidelines are if there's more than about 50 cc's or 10 teaspoons of fluid, then an aspiration is done. That's where a needle goes into the fluid pocket and is screened for cancer. If there's signs that there's no cancer, they're recommended doing nothing. We, of course, from a medical standpoint, would still take the implant out and change it out. So if there is signs of cancer on the aspiration, then the treatment is determining whether or not it's anywhere besides the breast. If it's confined to the breast, which is virtually all of them, it's removal of the implant and removal of the capsule, and then observation for a couple of years, and then as needed. If it's more extensive or outside of the breast, then there's a different treatment algorithm that's covered in the guidelines. Now the other question that people are going to have though, what if I just want to know if I have cancer and I'm not ready to change them? Well, it would be appropriate to get an ultrasound done. An ultrasound is pretty accurate. So if you don't have symptoms and the ultrasound is negative, you can safely say you do not have this type of rare cancer. If one of those things are present, either there's a lot of fluid on the ultrasound or you have symptoms, then the chances go up, and it would be a matter of being very, very aggressive about determining how far this has gone. Right now I'm in a situation where I'm talking to some surgeons throughout North America about what are going to be the best options. If somebody doesn't have any signs of cancer, we might screen them with ultrasound anyways before we do surgery to take out the implant and change it out. We're discussing how much of the capsule we should remove if somebody's totally asymptomatic, whether or not we should just leave it alone or take some portions out. So these things will yet to be answered. Another thing is, like, when should you do this? Well, the average person that had just diagnosed with this type of cancer, they had the implants in 8 to 10 years on average, so we know it doesn't happen right away. So if you just had them put in the past year or two, give us some time to figure out what's to be the best approach. There's no danger right now that we're aware of. So this is something that's very concerning to women. I think Allergan is, really on the ball with getting the implant recall started, but we really have to go a little bit further than that. Somebody's got to pay for these surgeries. Right now, the Allergan is not willing to pay for the surgeries for what they've acknowledged is a problem with their product. So stay tuned. We're going to come up with an approach so we can help women out and avoid this. And I want to just re-emphasize this is still extremely rare. They are very safe, and there should never be a product that we're using that causes cancer. It turns out, it took a little while before it really got announced, and now we're going to deal with it. But there's no really immediate threat if you do not have swelling, lumps, or skin changes. You can just kind of take your time and see how this plays out and talk to your surgeon. So we'd like to encourage people to ask questions. I'm still learning about what our options are. I'm talking to other doctors. I'm going to teach our ultrasound techs how to recognize fluid collections around the breast so we can make it easier for people to get diagnosis. So thank you very much.